My name is Nancy Dunch, and I'm a physical therapist and an instructor here at Waukesha County Technical College. Today we're going to talk about moving, transferring, and ambulating, that is walking, your residents safely. We want to be able to move them safely in order to protect them from any injury, as well as to protect you from any back injury that you may occur. We want to keep the residents moving for several reasons. We want the psychological benefit of keeping their independence as high as possible, as well as to keep them independent in order that you will not have to do as much work and strain your back. In addition, there are a number of physical benefits also. The physical benefits would include having your residents keeping their cardiovascular status, pulmonary, circulatory, and bowel bladder functioning. There's some things we first must consider prior to moving your residents. First thing to remember is that you must take your time. When you rush and move a resident around, it is perceived as being an uncaring gesture, as well as your risk of injury for both yourself and the resident increases. In addition, you want to make sure that you have ample room to maneuver not only the resident but also yourself. You'll be sticking with them when you are walking with them very close, and you need room for 2 people. So the furniture needs to have some room in between it so you can accommodate both of you. You want that the equipment be regularly inspected for wear. The tips of assistive devices are considered to be non-slipped. However, when they're used for years on end, the rubber does wear away and it becomes slippery. So they need to be inspected regularly and changed when they do wear out. These can be purchased at any number of drugstores, and they are just easily pulled off and stuck back on at the bottom. You want to make sure that the area that you are going to be walking a patient is clear from things like electrical cords, area rugs or loose mats, litter, debris, and water. You want to make sure that you have brought any equipment that you are going to need with you at the time prior to standing the resident. There is nothing more uncomfortable than standing a resident, getting them up, and realizing that the walker is over on the other side of the room. And now you have a safety issue. So you want to make sure you bring that at the time prior to rising them from the chair. You also want to make sure that you are mentally and physically ready to do the activity that you are going to do, both for yourself and the resident. You want to make sure that their clothing is secure, their shoes are tied, and that you have mentally prepared yourself for any unforeseen circumstances such as falling. First thing we must consider prior to moving a resident is your body mechanics. So we're going to view some of the basic principles of body mechanics. Body mechanics are very important for yourself, not only to conserve energy, but also to reduce your chance of injury, specifically the strain that you would occur on your ligaments, muscles, and joints. Also, using proper body mechanics will maximize your strength, and therefore the wear and tear that your body takes will be less. Some simple principles of body mechanics are first to remain close to an object. In this way, it's similar to carrying anything else. If I were to give you 10 pounds, you would probably not hold it way out here, you would hold it here. Because out here would require a lot more from you. It's the same when you're doing any kind of transferring. You want to keep the resident and anything else that you're moving close to your body or your center of gravity in order to maximize your strength. You want to also keep your feet apart. When your feet are next to each other, it's similar to having a pyramid balancing on its tip. You're not stable. So you want to keep your feet far apart so you have a stable base on which you can be maneuvering. You want to stoop or squat to lift and not move simply at your waist. You want to make sure that when you are moving, to pull just at the waist increases a significant strain on your back. Your back posturing should be at a lordotic posture, which is a curve that faces anteriorly or forward. So when you go to lift anything, the feet are far apart, you are moving your legs, and you're keeping this curve that is facing forward the entire time, up and down. It's easy for people to remember going down, but for some reason or another, they want to lift their seat up first, and then they become this arch. When you arch in such a way, you end up increasing the disc pressure themselves. You end up taking the muscles back to this stretched out posturing that we already spoke about, and we also end up putting the pressure on the weakest ligaments of your back. In addition, you want to make sure that you are not twisting at any time while you are lifting. Twisting and lifting increases the chances of injury significantly. Whenever possible, you should push or pull or roll or slide an object, if at all possible. We'll now review those principles of body mechanics. Number 1, remain close to the object. 2, keep the feet apart. 3, stoop or squat to lift. 4, maintain that lordotic posture. And 5, avoid twisting your body when you lift. Now that we understand body mechanics, we're going to take a look at transferring a resident from a chair or from a bed to standing. This can be accomplished safely if done correctly. It is important to have the resident participate to the best of their ability. This way it encourages them to keep their independence as well as less strain on you. The first and foremost thing that we need to consider with transferring is the safety belt. We will now see a demo on the proper use of a safety belt. Now we'll take a look at securing a safety belt. You'll notice that the clasp has a side that has teeth on one side and smooth along the other. You'll want to take the end and place it into the side that has the teeth first. Pull it so that the teeth will rest into the belt. Take the end of the belt and put it into the other hole so that it is covering the teeth. And you will pull it snugly. If it is too loose, you will push it from the first end past the teeth and then through the second. You want it to fit snug so that it is not suffocating, but yet you can fit 2 fingers between the body of the resident and the belt. Now let's take a look at putting the safety belt on a resident. We placed our resident in a stool so that you may see around the back, understanding that you would normally be doing this in a chair with the back. First we'll take the belt and place it around their waist. We then want to take the end and again put it into the area with the teeth first. Pull it so that it's snug and the teeth are against the belt. We then are going to take the end and put it into the second hole and pull. We now want to check for snugness. If I were to leave it at this, when we go to transfer, this would slide up her torso. So we want to make sure that it's snug. So we pull first here and then secondly at the end. The end can be tucked into the belt so that it is not free and will not get caught on something. Now that we have the belt snug with just a 2-finger width between the torso and the belt, we can now transfer the resident to standing or to another chair. Now that the belt is securely placed, we need to instruct the resident as to what is going to occur. We want them to participate as fully as possible, and so they need to have specific directions as to what they are going to do. We will now take a look at a demonstration on transferring. Now we'll look at standing a resident.